Peter Block in Orlando at the AHA annual meeting for On the Scene. With me is Lorenzo Berra from the Massachusetts General Hospital, my own home turf from many years ago. Lorenzo has been looking at the issue of kidney injury after cardiopulmonary bypass. Prolonged cardiopulmonary bypass, what makes your kidneys turn off? So, Lorenzo, I'm going to ask you to tell me about your trial. Nitric oxide seems to play some role here, so tell me what you did.
Yes, so we did a study with two groups. One patient group received nitric oxide, 80 parts per million, and the second group just received a mixture of gases, standard. And we give nitric oxide by the cardiopulmonary bypass machine during the procedure and after, when the patients were breathing through the ventilator. What we found was that when patients received nitric oxide, they had a reduction and decrease in acute kidney injury from 63% to 50%, and this we believe that is due to a better perfusion of organs due to the replacement of nitric oxide in plasma.
Nitric oxide in plasma, when it's replaced, becomes a vasodilator, doesn't it?
Yes, especially actually it's not a systemic vasodilator. It's a specific vasodilator for the pulmonary circulation, but it decreases and stops the vasoconstriction due to free hemoglobin when there is a hemolysis.
So this is a complex sort of mechanism, but the bottom line is kidney injury seems to be decreased in these patients. How long do you keep them on the nitric oxide after cardiopulmonary bypass? In
this study we kept it for 24 hours. And then they came off after 24 hours or at the extubation, if it was before.
Okay, so you had about 200 patients in your trial, so obviously not a very highly powered trial, but you did show a difference. So I guess we could discuss how important that difference is. Nevertheless, the p-value was 0.04, as I remember looking at the data. So tell me, Lorenzo, for the anesthetists and cardiologists out there taking care of folks that are going to have double valve replacement or a long bypass run, what's your recommendation from the data that you have in your head?
I think that at this time we would like to continue and to start a multi-center randomized trial. This is really a proof of concept, and we are going to do further studies. The second thing that I would say is that this is a new target in terms of prevention of plasma hemoglobin induced organ injury. So this is a mechanism that could be studied further for other diseases.
Okay, thank you very much, Lorenzo.
Thank you so much.